Guy, because of the new YouTube rules, anytime I'm making videos on any surgery stuff, I can't be able to bring all those in theater pictures for you guys to actually illustrate. Because once you bring any picture and there is blood, they'll just mark your video as shocking content. Alright? So you guys just have to manage with the little pictures I have and the explanation I'm able to give. Alright? So on that basis, we'll be talking about the lobectomy of the liver. Okay, lobectomy of the liver. Lobectomy of the liver is simple. The liver has the right and left lobe. All right. So lobectomy is basically like, okay, if you have a problem in just the right lobe, you might want to just remove only the right lobe. If you have a problem in the left lobe, you might want to remove only the left lobe. Do you understand? So the lobectomy of the liver is what we are going to talk about. We'll have the overview, look at the procedure, and look at the risks and complication of this what surgery. Okay, as simple as it is. So lobectomy of the liver is also known as what hepatectomy, but I would like you guys to say that partial hepatectomy. Okay, it's because you're not removing the whole of the liver, you're just removing one lobe. Okay, so it's a surgical procedure to remove one of the lobes of the liver. All right. So the liver has two main lobes, the right and left lobes. So removing a lobe is typically done to treat liver diseases such as what? Liver cancer. So it could be that the cancer actually affected one lobe, probably the left lobe and stuff like that. Okay. Or you are doing this to remove benign tumors or cysts. Okay. So what is the procedure details for preparation before the surgery? Imaging tests like what CT scan, MRI scans are done to determine the exact location and the extent of the disease condition. Surgery. The surgeon makes an incision. This one is just to access the liver, okay? And then he carefully removes the affected lobe, just one lobe, leaving one lobe, okay? So the remaining tissue, the liver has the ability to regenerate. So the remaining tissue can regenerate and grow back to its full size over time, okay, which is nice. Recovery time varies, but patient usually stays in the hospital for about a week. So full recovery can take several weeks to months. Okay. Risks and complication, bleeding. Of course, every surgery has a complication known as well bleeding. So liver has many blood vessels, so there is a risk of significant bleeding during and even after the surgery. Okay. Infections. With any surgery, there's a risk of infection because you are basically what going into the person. Okay, there's a wound, there's a risk of infection. The liver function, so ensuring that enough healthy liver tissue remains just to maintain the essential liver functions that we have. Okay, so that's just an overview. Here we're not here to do the surgeries. We're just here to tell you that okay, this surgery, this is what it means. This is how it is done. This is the purpose. These are the risks for it. Okay, so I think that's it for the lobectomy of the liver. All right, for the overview, procedure, risks, and complications. Okay.